So the DREAM initiative, it is so helpful because it brings other community groups together. And if there's a service I cannot provide, I'm able to reach to the other community groups. Quite frankly, before COVID, we were only servicing 60 families a week for food pantry. After COVID, we were doing 15,000 families per week. To date, we have serviced over 1.2 million people just for food. As you can see, it's not over for these people, these folks. I can't do everything, but if we are working together, we can help everyone.
Studies have showed that there are so many disparities in health services and health benefits and health conditions of South Asians, and we found that people don't have access to these services. Most of them, they have language barriers. They have limited English language skills. And due to this one thing, their access to health services and their access to culturally appropriate food and services was limited. So with the beginning of these services through an agency that speaks their language, that has manifold benefits for the community.
I think it's important because everyone comes from a different culture, different background, they're used to living a different lifestyle. So it's important to address these issues. Like most South Asian people don't eat a lot of fish or turkey, which have a lot of protein and benefits and omega-3 that can help them with that. So we help them by giving them proper diet and nutrition by our food pantry that they come by. So instead of like always consuming unhealthy food of soda, chips and like produced stuff, we give them a healthy alternative to manage their diabetes.
People who are connected with their own culture, they feel more attached and more trust the agencies. For example, the study that was done by DREAM initiative, the people who had diabetes, when they started getting culturally appropriate services and food, their level of diabetes decreased, their BMI and weight that decreased.
They are aware of their blood sugar and their hypertension, and they have now nutrition security through our food pantry.
How many family members? Two people? Okay, so how are you going to carry this? You have another bag?
Being a Muslim, we believe that there is a way to cut the animal, so that is halal, and yes, we provide all halal food, because if we say it's not halal, they don't want it. So we have to go by their belief and their religion background.
We're giving out halal chicken, we're giving out turkey. We make sure that everyone is happy, we make sure that everyone is satisfied when they leave, and also we check in on them. So I feel like that's what keeps people coming back for more food, and also just human connection, because I feel like we need that more in society.
We have a lot of elderly and a lot of disabled people that also come here. And even if they do not speak English, there's so many health workers here that from different nationalities. So we have Arabic, Bengali, South Asians, Chinese. So it helps them communicate better. And then we understand that, and then we take those points, and then for the future, we see how we can improve that.
Well, the most important thing is this DREAM initiative that the coalition has put together, and they've been helping us. We have been able to reach out to the community as they're online, and also finding out the troubles that they're in with diabetes, hypertension, there's also mental health issues. We'll hold workshops with our community partners, and it helps the community. They come, they eat, they get a chance to sit down and get all the health services that they need. If we teach the community, if we do those workshops, we can do preventative measures, and that's what this is all about.